right. Thank you so much, Maria Quinn, for being here today with us and to help us understand a little bit more about your role and what you do with NAMI Ohio PAC. So I will kick off with, and I'll let you do the introductions. And so I'll kick off with the first question, and then you can tell us more. Um, so would you mind starting us off with some brief introductions about yourself?
Sure. I'm Maria Quinn, and I live in Hocking County. It's me and my two children, my two grown children. I can't believe I'm saying that, but my two children, and we moved to Hocking County about a year and a half ago. We went through a major life change, and we moved to Hocking to kind of get a fresh start. So that's why we're here.
Nice. So you were working with the Vinton County Health Department, and that led you to the PAC program?
Well, no, I answered, I was looking for work, and prior to working for Vinton County, I became a certified family peer support specialist, and I was looking for work after that training, and and I happened to find a position for Vinton County for the PAC program. And so I went through that training. I got the job, then I had to do training for that particular position for PAC, and that's how it started. Vinton County got the grant for the PAC program, and then I was hired for the position. So that's how it started.
Ah, nice. So you've been with the PAC program for a little bit over a year, it sounds like.
Yeah, almost a year. Yeah, almost about a few, maybe a month shy of a year. So almost a year.
So for those who don't know about PAC or what it is, would you mind just explaining the program a little bit?
Sure. Yeah, it's PAC stands for Parent Advocacy Connection, and it's a program to help parents with children that are having challenges, whether they have problems with some kind of disability, mental health challenges. They might be involved in juvenile justice system or school. They may have IEP in school, different things like that. Yeah. So, and it's to help and support the parents, to empower them, to enrich them, equip them to be able to handle the different challenges that come with those things, and also to provide resources for them just to get support and help with it.
Wow. Oh, Maria, you're muted.
Sorry. Right. I think this program is important to the community. And can you tell us some impact that it has had?
Um, a lot. It seems like it's when I was describing it, I said it's small but a mighty program, and I really feel like it's just was getting started, but it helped. It really does help parents that are struggling, trying to whether it when it in particular I found that it has helped the most with children that have problems in the school system. They have an IEP, and some parents that I've worked with, they just struggled with that, finding helping their child to get the needed help even in school. Some trying to get an IEP. Some that I've helped, they had wanted and asked for an IEP for a long time, and they hadn't received one. Others, many of them just needed help in connecting with the school and kind of bridging the gap with their child in school and getting them what they needed so that they could thrive, so that they can, do better. So a tremendous help there. And then also many trying to understand what's going on with their child as far as the mental health concern. I helped in a lot of ways with that. So yeah, just a lot of things in that area that it has helped with. And then even for sometimes just listening to the parents. And then one thing about the PAC program, those involved in the program has to have lived experience. So we could say, yes, been there, done that. I understand. I really understand. And it might be a little different from what you're going through, but I hear you. I understand. And because of that, they feel more comfortable. I've had parents say, Maria, just you talking, letting me talk to you and you listen, letting me vent has really helped me a lot. I remember one parent, she said, Maria, I don't know what I would have done without you this year. She said, just you. Just you letting me vent and talk has helped a lot.
Yeah. And you having, your own experiences probably know what that means to someone to have that.
Yes, I do. And that's why it has been so passionate for me, because it's hard. It's hard for parents to because sometimes they're alone. They really are, and other people don't understand. And if they're not dealing with a certain challenge, then it's very hard for others to understand. And the parents that are going through it, they feel that, and they feel that, and they feel alone. So the PAC program, because of the lived experience from the provider, it really does help.
And I imagine it sounds like you did a lot of advocacy for parents. So, sitting around an IEP table,
Yes.
the school might look at that parent and say, oh, they've got someone sitting next to them.
Absolutely. Yeah. One parent, she said that before she would go to IEP meetings, she felt like they didn't listen, they didn't understand, and they didn't take her serious at all. And as a result, her child suffered a little bit because of it and continued to have problems. But then she said, but when you came with me, I felt more comfortable. I felt like I could speak up and talk, and that they actually listened. And as a result, her daughter is doing so much better, and she was able to get the needed resources and care from what she needed to help her. So that was wonderful. That so good, so good.
Absolutely. So, and then the other part is connecting parents to services. So, imagine Vinton County and Hopkins County. I mean, even Athens is a little further from Columbus, but so many people have to travel to Columbus for services. So it sounds like you would help identify and connect them.
Yes, yeah, and even local. local mental health services, because that's where I learned about a lot of the parents from a lot of the local um, uh, integrated services, Hopewell, and other ones. And just even in the communities, such as, because I work with not just Benton County. Actually, I did um, very little with Benton County. I got a lot of my referrals from Athens, Hocking County, Jackson County, and other surrounding counties through because that's those were my counties, were Athens, Hocking, Jackson, and Benton, and then surrounding counties that didn't have a parent advocate. So yeah.
You had a pretty wide catchment area then.
Yes, yes. Mm-hmm.
So you would get referrals from local behavioral health agencies to work with parents. So it sounds like what you did went above and beyond what those agencies could do.
Yeah. Yeah, and I really appreciated that because I was able to go in and talk with the group, the employees, and let them know what I was, what services I would offer, and help them to know how they could refer, people. And then they would ask me several times. I was able to go into those. Such as like integrated services and work with a parent that perhaps they didn't quite know how to help as far as like maybe in the school setting. So I work with them. I went to, they had appointments for IEP meetings. I went there, and other parents found me online through not the NAMI website and that parent advocacy program. So yeah.
You got referrals from all over.
Mm-hmm. Yeah. Yeah.
Sounds like a very, very important service to the community.
Very much so, because like I said, parents, and as I sit here and I think back to, I see different ones, that I worked with, and they were really struggling. I never realized and how hard it could be for the parent, especially in that school setting. Very, very challenging to deal with. Some say I have no clue of what to do. It seems like I'm just out of options. I have no idea what to do. Help me. You have to help me. So, we worked it out, kept working, and, trying to find different solutions. And just being there with them really helped a lot. Yeah.
Yeah, so it sounds like you had like the outreach part with integrated or behavioral health agencies, and then you had these one-on-one meetings or sessions with families. So can you give us an idea of like what your typical day would look like?
Yes. So the first part of the Parent Advocacy Connection was actually reaching out to organizations, the FCFC, and then other organizations, mental health, the schools also. So I would actually contact them, set up appointments to go and talk with them and share the program with them. And then as referrals started, to come, I would contact the parent and talk with them, and they would share their story with me, what they were needing help with, and we would go from there. Either I would set up a appointment to meet them face to face, whether in their home or at the library, wherever they felt comfortable. And many was just over the phone. And some were just even through text messages, because that's what they felt more comfortable with. And that was fine. We accomplished a lot of things just, through emailing and texting and talking. And so that was the typical days, either connecting with the organization, sharing what I do with them, and then getting those referrals, and helping the parent with whatever they needed. If they had an upcoming meeting, I would, and they wanted me to join them. We would go over how we would handle it, all of those things, and then I would go and be with them. Yeah, so that was, and then the other part is continuing to be in training mode too, because you learn so many things, updates and things and then me learning about resources in their particular area that they might need help with. So I could say, well, this place has this to offer, or, things like that. So that was my day. Yeah.
Wow. That sounds like very involved, right? So you have the direct service, so being a lifeline to the parents so that they can contact you and have somebody to reach out to. And then, on the back end, just knowing all those resources and knowing who to connect them to, and what this might look like and how to help. And then also just letting the community know that the service exists and that they can reach out to you. And so you spent that time kind of building those connections and getting those referrals rolling in, and now helping all these families, and sounds wonderful and impactful.
Yeah.
I do know there are some updates though with the program. Do you mind sharing with us what's currently happening with PAC and maybe what the future holds?
Yeah, sad to say, about 2 months ago, we learned that the PAC program was being discontinued. So as of July 1st, the program would no longer exist. So it's hard, because even I think about my program coordinator. She said, I fear for the parents. I fear what may happen. And sometimes when things like this program, it's small but mighty. Like I said, you don't realize, because even I don't realize, because it's like, oh, but when you listen to the parents, and then what you've been doing to help, you can see a big difference. When you have parents calling you crying on the phone, and it's real, what they're going through, you see, oh wow, this is really important. And then when you think of your own self, because not in a million years would I have ever thought that my family would be impacted by a mental health challenge. And then when it is, you realize, wow, this is heavy. It's heavy, and you don't always know what to do, where to go, and what's the most beneficial to you yourself. It could be something different for another family or parent, and that's the other thing with PAC. We try to meet the parent where they personally are, them, not someone else's. And so that's where understanding them and what they want or need was so important. So now, with the program being discontinued, some of the parents have said, what are we going to do? Who's going to help us now? Even though there are other, programs and things like that. But you could see that connection, that, is like a hands-on kind of connection, an emotional connection and understanding. and just being right there, like, for them.
Yeah.
Yeah.
Yeah. And they're calling you when they need help.
Yeah.
I mean,
Yeah. Some in the middle of the night
oh my
sometimes.
goodness.
So, yeah. Hmm.
Yeah.
Oh.
That's the
So,
hard part with some of these. Like we establish programs in the community when there was a gaping hole, right? And then after a year or two, we're like, oh, I mean, and this is the problem with funded programs or grant funded programs because it's very hard to sustain them if we don't have continual funding. Um, so are you able to like share if there are any other organizations that people can find resources in this gap, or if they're like what do you is there an individual organization or a private organization that is going to take something up like this, or if you know of anything?
That would be nice. None that I know of. It's it's become such a passion to me. I would love to do it all on my own, something like that. And I'm trying, but it'll take time. But there's always, like I said, I'm a certified family peer support specialist. So a lot of those things under that position is similar to what I was doing or am still doing up until tomorrow, until it ends. It's the similar thing. So a lot of let's say mental health facilities, they have like a person in house
Mhm.
that's a certified family peer support specialist, and their role is similar. So they would be able to help in that way, similar way. Um, and then other like mental health facilities, I even know Children's and Hopewell, they have one persons like that. So hopefully they'll be able to, connect the families when they, when it's a need, when they need it. So yeah, yeah.
What's next for you?
You know what? Right at this moment, I have no idea. I have no idea. Like I said, I would love to um, do this on my own, start something on my own. Um, but it'll take a minute to get that. Um, but yeah, but for right now, I'm looking for work. Hopefully, something will come up. I'm sure it will, but now, right now, I'm finishing up getting everything finished up with the program and everything. So yeah.
So this program was through the Vinton Health Department, right? Or that was where it was housed, thinking.
It was housed. Hmm.
Yeah. And I've seen some models of that where the health department, like it's mental health is kind of a core of the public health
Hmm.
system. Um, and I'm wondering if you can talk to us about like what were the benefits. I'm sure you've like seen like integrated or like separate entities like that, and when it's not integrated into the public health system, what are the strengths or challenges with a model like that?
Um, mm, that's a good question. I think, like with any kind of work or service, communication communication is like the is one of the biggest keys, but sometimes can also be one of the biggest challenges. Um, but just communicating, and when you see a need, to try to fill it. And then organizations like the health department, the public health department, they're surrounded by people that are in need of something. So it's like, it's the when you see a need and you know of a resource or a service that can fill it, share it. Just sharing it with the parent or whoever is in need of the service. And because, like I said, when I first started, in order to get the word out of the service to people, I had to contact people, call, and we were encouraged to contact FCFC, the schools. And so I had to go to the schools in order to and get it approved for them to even, accept the brochure, helping them to understand what service I was providing. So it's like, if you got if you know of people that need the services, especially if that's the jobs that you're in that deals with people, families, that have children, are also, like I said, the mental health facilities, when they know of it, just sharing it with them, and then referring them. And so when I went to talk with groups of people, for instance, like I was invited to come on several of Hocking County, Benton, the FCFC meeting, and then being able to be there to share, this is what I offer, this is what I can do to help parents that you may have. And then once they understood, then they could refer them, and then I took over from there with the parents. Some didn't feel like it was a good fit for them, but most of them, when I was able to share it with them personally, the parent, I was able to really help them, and they could see, oh wow, this is great, wow. So yeah, hopefully that answered your question.
Yeah, I mean, quick follow-up though. What does FCFC stand for?
Is Family Children First Council.
Okay.
Yeah.
All right.
Yeah.
Yeah, so it sounds like, when health departments are involved, and like our health department here in Athens just recently after the pandemic kind of took mental health as like um, an area that they even talk about or concentrate on. And I think they are a known entity to many of the public. So it's easier for them to even be that source to communicate those resources, and or connect people to those resources, because people might not always know about integrated or Hopewell, and there are stigmas associated with it, right? And so people are more trusting maybe of the health department than of other entities. So yeah, thank you for that. Sorry, Jordan. I could.
Yeah, no, I was just thinking too, there are barriers, I mean, it's great that integrated services and Hopewell, they can help so many people, but there are barriers like insurance or, getting to that. How do people find that initial intake appointment with an agency? They may not know. And that may be where, they start with that broad umbrella, like the health department. So that sounds like a fantastic model that works well.
And that was such a, I appreciate it about the PAC program, because unlike so many other ones that offer help, you have to, be under a certain income bracket or over. With the PAC program, it didn't matter. It didn't matter what, if you had Medicaid, if you didn't, that wasn't even something that was asked. The criterias were that if your child it was 18 and under, and if you child had a disability, mental health issues, challenges, juvenile justice. It could be drug addiction, something like that, things like that. And if you met two of those, well, if you were in school, 18 and under, you met one requirement, and then the other one mostly was some kind of mental health or something like that. The child had an IEP, and that was it. That was all the requirement. And because of that, anyone, could get help, could get the assistance they needed. And I found that it was such a relief to so many, because not everyone, not all parents are under that low income bracket. And because they're not, I've realized that they're missing out on some things that they couldn't get. But that's why this program was such a blessing to them, because that wasn't a requirement.
Yeah, and this is why also, like all of NAMI programs are important, because all of it is free, right? Which
Mm-hmm.
poses a challenge to um, us as administrators of it, or folks who work in it, because we are like, oh, where does the money come from to put these programs? But everything is free for the public. So that is why, like, we even fight for NAMI being a thing in our communities, because all the classes, all the services are free of cost to anyone. Um, Even though we have to, like, on the back end, find those gaps to fill the funding, right? And
Yeah.
like, fundraising is a huge thing for us, because we, in order to make these programs happen, or grant writing, and but most of our funding comes from fundraising efforts. But it's such an important, and doesn't replace any of the other services, but at the same time, an important one to have in the community, because it's totally free for the
Yeah.
public.
Yeah.
Um, I am curious, like, so you had about a year, and I'm not sure if you have numbers off the top of your head, but
Mhm.
do you have an idea of how many families you served, or how many um, individuals you served in Vinton County, or like in the neighboring counties?
Mhm. Yeah. So the grant wanted me for the year to have 40 referrals. That was the number that they wanted, and I I didn't realize that I actually did that. I actually got 43 referrals, and out of those 43, 35 families is who I helped specifically. Um, you know,
Yeah, that's amazing, especially because it was like a, like, ground up building program, right? Like,
yes,
it's easier a second year, because people know about it, and then there's word of mouth. But
yeah,
in the first year, to get the ground standing, like, to
yeah,
have 40 or 43 referrals is a
yeah.
lot. Yeah.
That's why I said it felt like I was just getting started. I mean, I felt that way because a lot of counties I don't feel like I touched as much. Like Athens, it's it's so much opportunity there. Now that was one um, that I just it was so much more needed to be done. I was like, I'm just getting started. But once I reached a few places, it was like I got snowball. I kept on getting more referrals and more referrals, and they were a lot more involved. Some parents, they might have needed me to go on a meeting, and that was it. Other ones, I mean, it was like, really involved, helping them with their family situations, things like that. And as a result, my it was like other maybe counties were a little bit less because I had a lot of people to,
Yeah.
to help.
Yeah.
So yeah, but I was very, very, just happy and proud of myself. I couldn't believe I was like, wow, that's good. And just doing it all by myself. It's like I don't have even though I'm up under Benton County Public Health Department because of I'm doing this particular program by myself and so I had to do everything, go out there and actually talk to people, make appointments, go and then deal do work with the parents and all of that. So but
Yeah.
yeah.
And And oftentimes I find that when you're in the rut of it, right, like we don't realize the numbers, right? We're like, oh, like today we had this disappointment or today we had this. But like to take that view after the fact and be like, oh, wow, I had like 35 referrals and 43 actually like, or 35 people I worked with and 43 and like, the ripple effect of that impact, right?
Yeah.
Like you change their lives forever, like
And
in some
that's not
ways.
just 35 people, that's 35 families.
Yeah, yeah,
Yes.
Family, I mean, I don't need to tell you all, but like a mental illness can tear a family apart. It
mhm,
can devastate a family. And so to the fact that you were there for those families, that's huge. That number is bigger than we even realize.
Yeah.
yeah, for sure.
Oh.
And I mean, like, and if anyone who's listening to this, we all realize how much of traveling it takes from Hawking to Vinton to Athens to like all these
Exactly.
cities.
Yeah.
Like, I'm sure you had maybe not an 8 hour day on a regular. You probably had 10 to 12 hour days, like
Yeah,
for.
and that was the other challenging part too, is that my position was part-time,
Mm,
but I would say, you know what, this is not part-time. This is not because it's like who you're gonna say, oh, I'm over my hours, so I can't talk to
yeah.
you. But that came in there a lot of times. And then there's a lot of things that you're doing
Mhm,
behind the scenes where you're that you have to take
mhm,
time to do in order to really benefit. Now you can put together anything,
mhm,
but when you're really trying to benefit someone,
mhm,
really take care of them and give them what they need that's serious to them. You're not just going to put something together. You have to take time to do it, research, and all of that. And that takes time,
yeah, yeah.
to research where a resource can come, going to meetings so
Mhm.
that you can understand this particular resource so that you can share it with somebody else. So,
And
yeah.
especially being new to the area, like you moved just for or like just before you started this position. So
Yeah.
I'm sure there was a lot of like learning to do about the area. And I mean,
It's good
I've
to
lived
have
in,
GPS. It's
but
like,
it doesn't really help in some areas because I've been there where it doesn't work. So there's no cell phone service. Yeah.
yes, I've gotten lost several times trying to find a school or a parent's house. So,
Yeah,
Oh,
you have to pull up your map before you enter out and then save it so that when your cell phone service goes, you have your directions.
yeah. Yeah, and I mean, as I've lived in Athens for 13, 14 years now, and it's and you get lost in these places that you're like, I don't know where I am, and this might be the last day of my life, right? Like, and yeah, all it takes is like one wrong turn. Like,
yes, yes.
yeah, but
Oh
go ahead.
gosh. No, it's just been such a pleasure hearing what you've been doing and the impact and how meaningful. I had no idea how wide-reaching all of the things that you did and the many services that you provided, and just that being that connection is just amazing.
Yeah. Thank you.
Yeah.
Um, I had a last question, if I may. This work is very heavy, I can imagine, and you're working very closely with people to, help through their issues, which might open wounds from your own life. And um, I am curious always when I talk to folks who do such heavy work, like how do they take care of themselves, or what do you do to not get burned out, right? Because that's what we see a lot with mental health professionals or healthcare professionals in general. So I'm curious on how you keep sane and like keep wanting to come back and do this over again.
um, I, the one question, why and how, um, is because I think it's because of that lived experience. So it's like, um, I'm not gonna give up. I don't want to give up because it's like continue to keep trying. So if you're that way, that is how it can be for another family too. Um, because, and then I'm very religious. I have a faith, and that's the most important thing, and that's what helps me the most. But then, just read. I like to read about, what can help more as far as mental health is concerned, and um, just and then I exercise. That's another thing that helps. And I actually, have have a little program that I'm developing in that area for wellness. Um, that helps. And then just recently, I got a bike. My daughter and we got, and that has been helping her and me. So just keeping active and busy, and then um, just trying to be positive, realizing that, um, you know, just trying to keep going, and then finding little things along the way. Because I said, even though I may have helped ones, I have been helped.
Mhm.
I mean, it helps me being able, because I've learned a lot just being, doing what I'm doing for others. I've learned so much myself. And that too has been helping me. The things that I've learned along the way, I'm able to implement them in my life and in my family's life. Um, and then to be able to even help other people. So now I'm in that mode, even people that are not as friends, family, people that I just meet throughout. It's like, oh yeah, that can help you, this, that, and the other.
It's
So
hard to turn
yeah,
it off sometimes, huh?
yeah, yeah.
Oh,
So yeah, and then the trainings too. I
Mhm.
get on training calls, and they're I'm like, wow, this is so helpful and so useful, because you have to, in order to keep up your license as a certified you have to, get on trainings and do things like that, and you learn so much there to help you. So those are other added things, that helps. And then just and also when you have a parent that says, you know what, I don't know what I would have done, without you, that helps you to understand, okay, well, I'm ready to do it again.
Yeah. It's
Oh,
always
yeah.
hard in a helping profession to like see that, right? Because you always immediately get the negative reactions like, oh, you didn't do enough, or you didn't do this for me. But when you get that kudos is like really impactful even for you to keep doing it. Yeah, yeah.
Yeah. Yeah.
Thank you so much, Maria. This was such a pleasure to talk to you.
Thank you. I enjoyed sharing it. I really did. Thank you.
I'll go ahead and stop the recording, and then we can